Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam from Houston, Texas. The focus of this presentation is diabetes and how do we diagnose diabetes. We're going to be talking about hemoglobin A1c. What is hemoglobin A1c? What does it represent? And how do we diagnose diabetes? What is the normal range? What is the abnormal range? So let us begin with the feature presentation. Hemoglobin A1c is a reflection of the level of blood sugar in the body. And it is an indirect reflection because it is calculated by the amount of glucose that is attached to the red blood cells. As you can see with my green arrow here, it is determined by the amount of glucose that is attached to the red blood cells. When the glucose is attached to the hemoglobin, the molecule inside the red blood cell, the hemoglobin is converted into hemoglobin A1c. So the higher the amount of hemoglobin A1c, the higher is the average blood sugar level. As a matter of fact, the hemoglobin A1c is like a long-term reflection of where our blood sugar levels have been in the last month or 2 months. So it is not something that changes on a daily basis like the regular blood sugar, but if your blood sugar is consistently high, there is more deposition of glucose in the hemoglobin. As a result, hemoglobin A1c goes up. So the normal hemoglobin A1c levels should be 5.6%. But if the amount of hemoglobin A1c is between 5.7 and 6.4, that's called as pre-diabetes. That's somewhere we have to be quite careful. If the hemoglobin A1c level is 6.5 or greater, it is called as clinical diabetes. That means you have the beginning of diabetes mellitus or diabetes, just as such it is called. What is the relationship between the hemoglobin A1c and the average blood sugar, let's say for the past 6 to 8 weeks? If your hemoglobin A1c level is 6%, that means your average glucose is 126. We are talking about fasting blood sugar. The fasting blood sugar should be between like 90 to 110. Obviously, your sugar is already beginning to go up. If your hemoglobin level is 7%, your fasting blood sugar is like 150 milligrams on the average. The target of diabetes treatment is to keep the hemoglobin A1c level below 7 with all the modalities of treatment we have. If you are in a pre-diabetic state or early stages of diabetes, that is something which can be controlled with vigorous diet and exercise. It is a reflection of a long-term blood glucose level over 6 to 8 weeks. When glucose is deposited in these red blood cells, it stays there for almost 3 months. So the hemoglobin level is not going to change within 2 weeks or 3 weeks if you go on a rigorous diet or exercise or a combination of those. But this has to be a long-term, lifelong process of getting our acts together to bring the hemoglobin A1c level. Can we bring the hemoglobin A1c level down with diet and exercise? Absolutely yes. Because the higher the glucose you put in your body, the higher will be the hemoglobin A1c, which is a reflection of a higher blood sugar. As you progressively cut down your carbohydrates, the blood sugar level will come down, which will eventually bring down the hemoglobin A1c level. And if we exercise, that will also help body to burn more glucose. As a result, the overall blood glucose level will be lower. So that will be reflected in the hemoglobin A1c level. So if your hemoglobin A1c is 7, you have to be on a program for at least 6 to 8 weeks or longer to see a substantial decrease in your hemoglobin A1c level with vigorous diet and exercise. This is a very complex management. You have to see a primary care doctor or an endocrinologist and consult with a dietitian as how you adjust your calorie intakes so that you minimize the amount of carbohydrates that you take in order to reduce the blood sugar level, which will eventually bring down the hemoglobin A1c level. There are different types of diabetes. Just to say, type 1 diabetes is seen mostly in juvenile or younger people whose body cannot produce insulin. As a result, they have to depend on insulin. And that is a more serious kind of situation. Whereas type 2 diabetes is seen in the adult population towards the age 40, 50, 60, 70, where it is associated mostly with obesity and other medical problems. And in type 2 diabetes, the body is able to produce insulin, but there may be insulin resistance because of obesity and because of excess calorie intake. And all these things can be controlled with diet, exercise, and weight reduction. Gestational diabetes is something that you see mostly in pregnant women, and it usually disappears after the pregnancy is over. There are some rare conditions known as monogenic diabetes, which is a congenital form of diabetes, and diabetes is also seen in patients with cystic fibrosis. And these are some of the basic concepts of how we diagnose diabetes. So ladies and gentlemen, this is a quick overview of what diabetes mellitus is, how we diagnose diabetes mellitus using hemoglobin A1c level, and how it tells us how well our diabetes is controlled. The key is to make sure that we bring our hemoglobin A1c level below 6.4 or below 5.7, so that 5.6, so that you can control it with diet and exercise. Thank you so much for watching this presentation. We have numerous presentations on health related topics. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next video.